We're all leaders in our own rights. We're leaders in our home, we're leaders to our peers, we're leaders in different ways. And we can all be a part of changing the systems. We all have a role to play in it.
What do you feel are things that contribute to poor health outcomes for minority women, especially when it comes to pregnancy and birth?
A lot of clinics that offer free healthcare don't have enough funding to provide services to a lot of African American and Hispanic women in underserved areas. So lack of access is a huge one. But I also think with regards to that, there's misinformation and miseducation about when to ask for what you need. My biggest priority for patients, any type of patient, is that they come when they're healthy, rather than wait until they're in the hospital and the ER, emergently seeking imaging and testing. And it starts with education, and it starts with taking the time.
As a doula, I really play the role of helping women find their voice in a very vulnerable place of birth, because you're not in your right mind, you're very animalistic. And to be pulled out of that animalistic state to sign a waiver can be frustrating, can also add additional stress. So stress, environmental stressors play a huge role. The other thing is making sure you find a care provider that you really connect with. Insurance doesn't always allow for that, but you are a consumer for maternity care. Choose your care provider carefully.
Trust of the healthcare system itself. Even though the hospital was filled with people that looked like them and spoke their language, they still didn't trust the system. Then you talk about communication barriers, cultural sensitivity. Do I even understand what you're saying to me? You say I need a C-section, I'm scared to death. I'm just gonna do what you say, not even able to ask a question because I am so vulnerable. And I think once a patient can be heard, they can be cared for. And once they can be cared for, their chances of a bad outcome happening are lower. And it takes that physician to be able to get out of their own head, so to speak, and tune into the person sitting in front of them. Before they even touch them, they have to know who they're sitting in front of. Is that person anxious? Are they scared? Are they, whatever their emotion, you have to identify that before they can hear us.
I definitely have experienced a lot of a need to self-advocate during the processes of giving birth to the 6 children whom I birthed in a 10-year span. So that was a definite thing I had to do, advocate a lot. It provided me tremendous comfort to have an OBGYN who was a Black woman, and some of you here know her, Carol Jordan Harris. She has since passed last year, and ironically she died because of these issues that we're talking about. But one of the problems that we face as Black, Latin, and Asian women, of which I am all those 3, is that there's this value, like this low self-worth, and we put ourselves often last.
I want women to know themselves, and that's all-encompassing, but I'll just kind of break it down. When they come into my office, I want them to feel that there is no judgment, that it is a safe space just from walking into the space.
That same hesitance to speak openly about one's sexuality as a woman also translates to keeping silent about sexual violence. And then also just that, Cara and I were talking about the science of epigenetics, where they take these great institutions now are taking populations of fruit flies and mice, and for example, they take one generation and shine a light and then electrocute it, and the fruit flies do this frenzied dance. And then 2.5 generations down, when they find that when their descendants come to that same light, without being electrocuted, they still do that frenzied dance, meaning that the trauma of our ancestors is actually remembered in our genetics, in our DNA. So what role does that play in us as descendants of slaves in 2018 for how we react, our PTSD?
Yes.
How does the trauma of our ancestors remember? Why is it that 1 in 3 Black women do experience intimate violence at home? Why is it? Do we tolerate it? Are we used to it?
Like, what in your experience do you want women to know in particular about their health?
You know, women are still very uncomfortable about talking about sex. It's something that they it's cringe-worthy topic. You know, who are you having sex with? Men, women, or both? Whoa, what? Like, what are you? Meanwhile, they're sitting in front of me in their underwear and like, the conversations I'm finding aren't being had in the community. Like, I see a lot of new patients because I'm a newer practice. And you know, a lot of the sexual health topics that I cover, whether it be who are you having sex with, have you ever been diagnosed with an STD, do you know what STD screening involves? Are you using condoms sometimes, always, or never? What's your form of birth control? Are you family planning? Have you had a PAP? Was it abnormal? Do you know what HPV is? You know, all of these things, it's a common response for a lot of the women to say, whoa, that's really thorough. Like, that's the most thorough I've ever had. And I mean, this is just standard of care. It's astonishing to me how people can have all of these partners, especially women, and never ever ask to their partner, have you been tested for an STD? Before they lay down naked with this person. So I pointed out, just like I'm speaking to you guys right here, just in this tone, how are you to lay naked with someone and not ask them first, have you had STD screening and when? Like, it's not that difficult, right? But it is.
The demographic that you care for, I feel like, is still that generation where it was shame. Don't talk about it, don't touch it. And I think that conversation, as we are mothers, needs to change for our children. I know with my daughter, she knows her vagina, she knows where her urethra is, her anus. We talk about all these things. She also knows that if she's uncomfortable with someone wiping her, that don't let them do it, you know? So that conversation has started so early. We went to her pediatrician, he's like, okay, I need to check you now. She's like, okay, he's like, but no one but your doctor, if it's okay, can check you. She's like, yeah, or I kick them in the private part. So yeah, we work with this at all.
It's still very much, taboo. It's still very much, don't talk about it, but we all do it, so it's like, why not have the discussion, especially with our providers who we should be able to trust.
And then it ripples out to talking about it amongst our friend group. Then it becomes part of the normal conversation, normalizes it in the greater scheme of what's important to us.
Mm-hmm.
And along the vagina conversation, I wear a button every day. It says, is your vagina happy?